CPT JJCPV Introduction, page 12, part 16.
Selection of procedure. Continued.
We're continuing the selection of procedure, right? And now we were talking about the physicians and the medical staff, right? But now we're going to talk about the clinical staff members, and these professionals are distinct from clinical staff, which means that the physicians are distinct from clinical staff, right? What's a clinical staff member?
A clinical staff member is a person who works under the supervision of a physician or other qualified healthcare professional.
Right. There has to be a physician or a qualified healthcare professional present when the procedure is going on, and the other staff that just help him, those are the clinical staff members, okay? So that's what we're talking about, the people who help the qualified health professionals, which is a physician or probably a nurse or somebody who has a degree that allows him or her to take care of the patient, right? Now, a clinical staff member is allowed by law, regulation, and facility policy to perform or assist in the performance of a specified professional service. So they can perform or assist a procedure, right?
Right.
What else?
A clinical staff member does not individually report that professional service.
Right. To report it to an insurance company or to keep it in the record, a clinical staff member can't do that. They have to. It has to be a physician or a qualified healthcare professional present to certify that the procedure was done. Right.
Right.
The other part is that other policies may also affect who may report specific services, right? Sometimes there are some services or procedures that have to be specified only by a physician, right? No, not by a nurse. But that's the policy of the institution, right? So in a summary, the clinical staff member is a
person
who
works under supervision of a physician
or other
qualified healthcare
professional. That's all our theory for today, okay? So now we're going to do a problem. So ready, set, go. Okay, CPT RVA, page 255, exercise 54. This is a level 1 exercise and reads like this.
Surgery, cardiovascular system.
Okay.
Patient complains of recurrent syncope.
Syncope.
Following carotid thromboendarterectomy.
Okay.
Patient returns 2 weeks after initial surgery and undergoes repeat carotid thromboendarterectomy.
Okay. It's a surgery part of the CPT code, and it's the cardiovascular system, right? The heart and the arteries and the veins, right? That's the cardiovascular system. And the patient complains of recurrent syncope following carotid thromboendarterectomy, right?
Right.
And then the patient returns 2 weeks. This is important, remember, 2 weeks after initial surgery, and undergoes another one or a repeat carotid thromboendarterectomy. Okay, so that's the procedure, right? And now we're going to count to 3, so you can pause the video and give us the CPT code for this procedure. 1, 2, 3. Okay, the answer is 35301. Okay, you got that? If you got it, congratulations. If you didn't get it, let's explain a little bit of what it is, right? Give you a tips. Okay? All right, the first tip is?
Start with thromboendarterectomy.
All right, and you ignore?
You ignore the first visit. You will not find a code for repeat.
All right.
And it is not reoperation because patient comes back in less than a month.
Right, for it to be considered reoperation, at least a month must have been elapsed from the first operation and the second one. Since this was in just 2 weeks, you can't consider that, right? So you just treat it as a thromboendarterectomy individual with no previous history, okay? Now, so you can understand, because this is kind of a difficult word, but to understand just the procedure, just divide the terms, right? Thrombo means?
Thrombo means embolus or blood clot.
A blood clot, like it is a solid blood that is clotting the flow of the blood, right?
Right.
What's endarteral?
Endarteral is an artery inside.
An artery or one of those tubes that is inside, right? And ectomy means?
excision or taking out.
Excision or taking out the embolus and part of the artery inside, right? So summarizing, a thromboendarterectomy is an
excision of an obstructing
thrombus
thrombus together with a portion of the inner lining of the obstructed artery.
right? So you just gotta take out the thrombus and you're gonna take out part of the artery, the lining of the artery, okay? So it's not difficult, it just looks like a big word, but if you divide it, you can understand what the procedure is. Okay, once we have explained to you a little bit more about the problem, and you know the answer already, the answer is 35301. Now we're going to count to 3 so you can give us the path to the answer, how we got to the answer, okay? So 1, 2, 3. Okay, this is the summary of the whole problem. This is a surgery section of the CPT code, is a cardiovascular system. The patient complains of recurrent syncope following carotid thromboendarterectomy. The patient returns 2 weeks after initial surgery and undergoes repeat carotid thromboendarterectomy. That's the procedure, and there's only one code, and the code 1 through the index is found like this.
First, you go to index.
Go to the index.
Then you go to thromboendarterectomy.
Which is the procedure, right? Thromboendarterectomy, right?
Yes.
And then you're going to go to the body part, which is?
Carotid artery.
The carotid artery. Why? Because it says carotid over there, right?
Yes.
So you get 2 codes there. What are those 2 codes?
35301 and 35390.
90, right? So those 2 codes, it has to be one of those. So you go to the tabular, so the code 1 through the tabular, and we're going to see the text for each code, right?
Right.
So the code 1 through the tabular is found like this.
First, you go to tabular.
Go to a tabular, and you start with the first code, right?
Yes.
Which is?
35301.
What is that?
Thromboendarterectomy, carotid.
Carotid, right? And then let's examine the second one.
Okay. 35390.
And what is that?
Reoperation.
More than 1 month, right?
Right.
So if the second operation has been done after more than 1 month, then that's considered a reoperation. But this was done just after 2 weeks, so it's not a reoperation, right? So you just go back to the first one and treat it as if it is a thromboendarterectomy, right?
Yes.
A simple thromboendarterectomy, and it's the carotid part, the carotid artery, right?
Right.
So that's why we have an equal sign there, and the answer is 35301. Okay, so that's our problem for today. Don't forget to visit our website, and also
you can subscribe to us in YouTube by clicking here for our new medical coding videos.
all right, in the subscribe word in red over there, you just click there and you'll be subscribed to our videos, right?
Right. You will get up to 3 videos every day that we make, ICD-10s, CPTs, all that is needed to pass the medical coding certification exams.
Okay, so thanks a lot. Thanks for watching, and don't forget to visit our website and subscribe to our videos. Thank you.
Goodbye.
Bye.